In New Brunswick, we do have a law that requires all government institutions to supply services in both official languages. So, of course, that requires quite a high level or a high number of bilingual positions within the organization. What we do to be able to fulfill that is we work with managers to determine what the linguistic profile of that department would be. So we've specifically built tools that help the manager keep track of the clinical abilities or the clinical requirements of the position, but also the linguistic capabilities of each employee, and also that keeps track of the hours of operation. Because in a complex world like healthcare, we're a 24/7 operation, so that requires a little bit more juggling with linguistic profiles and how we determine who needs to be bilingual to have that coverage. We work with the managers to complete these linguistic profiles. These profiles also allow the managers to identify where the gaps are. So since they don't necessarily have any vacancies at the time that they can hire more bilingual staff, what we do is we have a backup plan, so our contingency plan. The manager must identify who they can reach out to for their staff members in the case that someone would require services in French or in their second language. Within the organization, of course, we have a certain number of linguistic requirements, and once a position is deemed, or we've made the decision that a position should be bilingual, what we've done is we've built another tool, a questionnaire that will help the manager make the decision what level of proficiency does this position need to be. So if it's a position that requires, registering a patient, we'll ask their name, their address, and simple information and repetitive information. The linguistic abilities may be not quite as important. They're still required, but not at a higher level. Where clinical expectations are involved. In those cases, the questionnaire, by answering it, will tell the manager that a higher proficiency would be required for these positions.